This was a cruel, calculated and cynical campaign of child.
It seemed to be a pattern. It seemed
This was a cruel, calculated and cynical campaign of child murder.
the case of Lucy Letby has become one of the most controversial of modern times. Convicted of killing 7 babies and attempting to kill 7 more, Lucy Letby will die in prison. But doubts about the case against her are not going away. And what started as the voice of a few experts has become a campaign to have her case reviewed by the highest courts in the land.
There is now strong and compelling evidence that these convictions are unsafe.
Day by day, new revelations are coming about that really point to the fact that she may well be innocent of everything.
Concerns are now being raised from the wards of our hospitals.
Many of the nurses don't feel that Lucy was responsible for these babies' deaths.
And in the corridors of our parliament.
I've got to make sure the person we've sent to prison for the rest of their life is actually guilty.
Shocking new evidence continues to emerge about a case that once seemed clear-cut.
The Crown Prosecution Service has accepted that they got it wrong on the door data.
Nurses were warned by the management not to speak out in support of Lucy Letby.
Could we be looking at one of the biggest miscarriages of justice in our recent history?
I don't want it on my conscience that an innocent person is locked up in jail for the rest of their life.
The Lucy Letby case has gone from whisperings on social media to the corridors of power, and has now been questioned in Parliament.
The New Yorker magazine published a 13,000-word inquiry into the Lucy Letby trial, which raised enormous concerns about both the logic and competence of the statistical evidence that was a central part of that trial.
I'm David Davis. I'm the Member of Parliament for Goole and Pocklington, and I've been taking an interest in the trial of Lucy Letby since a whole number of experts have started to worry about whether it was a mistrial.
In May 2024, he raised the issue at Justice Questions in the House of Commons.
The more I went through it, the more I was concerned that the trial had flaws. People said the evidence was circumstantial. It was sort of worse than that. Quite a lot of it was judgmental. It was people's assessments. I mean, at no point did anybody see Lucy Letby kill any child or do anything visibly connected to killing the child. You know, so what do we really know? I spent months going through this with a simple thought at the front of my mind. If I found another piece of slam dunk evidence, if I found a piece of evidence which said, actually, she's guilty, I would have stopped dead. That would have been it. I wouldn't have gone any further. You don't want to challenge a jury trial unless you really think it's important. You don't want to give the parents more pain of going through it again. You don't want to cost the state loads of money. There's all sorts of reasons not to pursue something like this.
But now, new information, which some experts say could challenge the case against Letby, has come from the Crown Prosecution Service. They have now admitted that some of the door swipe evidence presented during the original trial was incorrect. This evidence was used to track the movement of staff in and out of the neonatal intensive care unit.
Some of that swipe data was backwards, and so it was unreliable. And just to admit, that data was already doubtful for other reasons, but after that, it's completely untrustworthy. Something as fundamental as this was as persuasive as this, when it turns out to be unreliable, it's really, really corrosive to the case.
I think what is remarkable is that the Crown Prosecution Service, post-conviction, has accepted that they got it wrong on the door data. Now, I don't know yet how important that is to the whole structure of the trial. My gut feeling is that this is one of many areas of unreliability, and it's together as a combination of points that makes this conviction unsafe.
My name is Mark MacDonald. I've been a barrister for just over 26 years. I've been working on miscarriage of justice cases now for probably 15 to 20 years.
I've now been asked to represent Lucy Letby. So I'm currently working on and drafting the application for the CCRC, which is the Criminal Cases Review Commission. It's a body that's set up, and it's the only body that allows you to a conviction to be referred back to the Court of Appeal.
Lucy Letby first came under suspicion when the Countess of Chester neonatal unit experienced an unusual cluster of deaths of babies in their care. Doctors spotted an association that Letby was always on shift when the deaths and collapses of babies took place. It seemed to be a pattern. It seemed she was the one common denominator. A rota spreadsheet was presented at court covering 13 months between June 2015 and June 2016.
One of the most persuasive pieces of information at the beginning of the trial was a table apparently showing that the only nurse who was on for all of what they said were murders, actually just 7 of the deaths, but what they said were murders, the only person was Lucy Letby.
But now, the rota spreadsheet has been described as scientifically worthless by the Royal Statistical Society.
We know already that there's a problem with the rota. We now know that there's a problem with the door swipe data. And I think this all builds up to a situation where you cannot believe the central core of the prosecution case that there's any sort of pattern.
And now, information from a whistleblower has revealed that a deadly superbug was present in the unit at this very time.
The last thing in the world that you want dribbling into a unit which has got very, very vulnerable newborns is sewage.
Following the new revelations about incorrect door swipe data and the problems with the rota spreadsheet, additional new evidence has now come to light about the conditions within the hospital itself. Dr. Phil Hammond has been writing about his concerns with the case, including the state of the unit.
I've been Private Eye's medical correspondent for 32 years. I was an NHS doctor for 35 years. If you see a spike of deaths, you need to try and investigate to understand why. There were facilities problems in the Countess of Chester neonatal unit. It was an old unit, built in 1972. There'd been campaigns to upgrade it. It didn't have enough space. The unit was quite cramped.
An additional problem with the unit was also highlighted in court when a hospital plumber was called to give evidence that sanitation was an issue. He gave testimony on the frequent drainage problems, which included foul water backing up in wash-hand basins in the intensive care suite.
The last thing in the world that you want dribbling into a unit which has got very, very vulnerable newborns, some of them premature, is sewage, which is full of bacteria. I'm David Livermore. I'm recently retired as Professor of Medical Microbiology for the University of East Anglia. In my time of 14 years working for the Health Security Agency, I've seen many outbreaks of infections at hospitals, and I've seen some tragic events in the course of them.
The plumber's testimony has led experts to question the possibility of infection as a cause of death in the unit. And now, a leaked risk report has revealed that the hospital did have an outbreak of a deadly bacteria at the time.
Not only do we have the issues of sewage leaks, which the plumber described at the trial, we also have a leaked report that's come out subsequent that the unit had a problem with a tap or taps colonised by Pseudomonas aeruginosa.
Pseudomonas aeruginosa is an antibiotic-resistant bacteria found in water or soil, which can cause infection, especially to those with weakened immune systems. In 2012, 3 premature babies died after contracting the bug at a hospital in Belfast. In that case, sink taps were found to be the source of infection.
We got leaked a report which said actually the hospital was struggling with a bug, Pseudomonas, and they had been trying to eradicate it, and they hadn't been successful. This was at least a significant risk of being one, if not the whole cause of the spike, and it should have been told to the jury.
In 2015, the Countess of Chester neonatal unit had level 2 status, which meant it was caring for babies from 27 weeks and providing high dependency and intensive care.
Many of these babies were not well. Several of them were very premature. Now that's important because a premature baby in particular does not have any sort of proper immune system. A baby that's born at the normal term has some immunity coming through its mother. Antibodies cross the placenta into the baby, and that gives the infant a little bit of protection against the run-of-the-mill infections that it's going to face in the world out there. But a tiny baby born at 29 or fewer weeks has none of that protection. It's incredibly vulnerable to infection from bacteria and indeed viruses that would be harmless to you or I. We need very much to know what investigations the microbiology department did on individual babies to look at the general microbiology of this unit. The report about Pseudomonas came out as a leak, not an official statement from the hospital.
When I was there, we had an outbreak of tiny little black insects, and they had to call an exterminator in. Now, this is a neonatal unit with the most vulnerable babies and numerous environmental problems within it. My name's Michelle Warden, and I was the advanced neonatal nurse practitioner on the neonatal unit at the Countess of Chester Hospital.
As an advanced neonatal nurse practitioner, Michelle Warden was one of the most senior clinical nurses on the unit. But in 2007, she was made to take compulsory redundancy from her role.
Myself and 7 other nurses, so 8 in total, by various methods, had been either removed, dispensed with, retired, under various guises. The hospital called it restructuring. That's just another name for cost-cutting. In 2012, the Countess of Chester neonatal unit employed 2 brand new, newly qualified nurses straight out of university, one of whom was Lucy Letby. Following that, Lucy did undertake what's called the QIS course at Liverpool Women's Hospital, which is a 6-month course in special and intensive care neonatal nursing. So when the spikes occurred in 2015, Lucy was deemed to be senior. However, Lucy had actually only been qualified for 3 years. I cannot imagine any profession where you would be deemed to be senior after only 3 years. And certainly there's no comparison with somebody like myself and the other senior staff who have got 30 years experience under our belt. I might have left the Countess of Chester in 2007, but I'm in contact with many of the nurses who remained on the unit and worked with Lucy. They had serious concerns about what was going on in the unit, and many things, from my understanding in court, were not presented, which could be a huge contributing factor into the spike of these babies dying and their unexplained collapses.
But when a 7th baby died on the unit in 2016, the hospital took action to investigate.
Often what happens when a unit has a spike is they ask for an independent view. And the Royal College of Paediatrics and Child Health came in and found they didn't have enough consultants. And sometimes the junior doctors were reluctant to call for help.
The Royal College of Paediatrics and Child Health report found problems with staffing, competencies, leadership, team working, and culture.
What we saw here was the erosion of capacity and capability by getting rid of the senior nurses, but not changing the aspiration of the hospital. So they were taking babies that were under 32 weeks, but they just didn't have the right kind of staff to look after them safely. And this is really what paved the way for what was to come in 2015-16. I'm John Ashton. I'm a doctor, and for many years I've been a director of public health. I was the regional director of public health in the northwest of England for 13 years. I've had to deal with a whole range of disasters and emergencies and examples of clinical service failure. There's a general view that what you're looking at when you have a disaster of whatever kind, including a clinical disaster, is a lining up of all the factors, like all the holes in a Gruyere cheese, all lining up in one place, that makes something inevitable to happen when you look at it in retrospect. And the more this has gone on, the more I am convinced that this is very likely to be a major miscarriage of justice. This was a poorly performing hospital, as described in the report by the Royal College of Physicians and Child Health, and you did not need a murderer to account for the serious untoward incidents, including deaths of babies, that occurred at this hospital in 2015 and 2016. It's now emerged that nurses from the Countess of Chester were warned by the management not to speak out in support of Lucy Letby and against this criminalisation of her and assassination of her character.
I think within nursing circles there is a definite fear now after Lucy Letby's arrest and subsequent conviction. There is a genuine concern that nurses are vulnerable to outside factors coming in and pointing the finger.
By June 2016, Letby had been taken off night shifts. She was then removed from the unit completely and transferred to an admin role.
On the 7th of September 2016, Lucy Letby lodged a grievance regarding her removal from duty as a nurse and her moving to a desk position. I'm Dr. Faye Skelton and I'm a lecturer in psychology at Edinburgh Napier University. My main interests are cognition, whether we can detect deception with any sort of reliability, particularly applied to the justice system. Lodging a grievance is a really serious thing to do. So to me, this speaks of somebody that just want moving back to their position because they see the removal as unfair.
The hospital upheld Letby's grievance, and the consultants were asked to apologise to her. But because of the association between Letby being on shift and serious incidents of deaths and collapses, doctors continued to suspect her. In May 2017, they went to the police. Lucy Letby never returned to nursing duties. A criminal investigation began, and a year later, Letby was arrested.
Hello, Lucy, is it? Yeah. Hello, my name.
Cheshire police footage of her arrest in 2018 was later released to the media.
Lucy Letby was arrested for the first time on the 3rd of July 2018, just almost 2 years after she was moved to a desk job. Whether Lucy Letby is guilty or innocent, when a person is arrested and criminal allegations are brought, that is going to be frightening.
Did you have any concerns that there was a rise in the mortality rate? Yes. Okay, so tell me about that. What concerns did you have?
I think we don't just notice as a team in general, the nursing staff, that this was a rise compared to previous years.
Lucy Letby was arrested 3 times during a 3.5-year police investigation. Multiple searches took place at her home and work, leading to thousands of paper documents and digital forensics being seized. The police made a breakthrough discovery.
"I don't deserve to live," she writes.
Police had discovered handwritten notes in her diary.
"I killed them on purpose because I'm not good enough to care for them. I'm a horrible, evil person."
Most people would agree that killing babies is the worst thing you could be accused of.
They were widely reported in the press and presented in court as a confession. But now, new information has come to light about why the post-it notes were written.
Maybe now the public will see these notes for what they really are.
In October 2022, Lucy Letby's trial began.
Lucy Letby was working in the neonatal unit of the Countess of Chester Hospital at the time of the infant's deaths. Sky's Caterina Vitozzi has the latest for us from Manchester.
The prosecution believe Lucy Letby murdered 7 babies and tried to murder 10 others as a neonatal nurse working on that specialist ward.
The evidence appeared damning. She was accused of weaponizing her medical expertise to wreak multiple, unimaginable acts of murder.
The prosecution say what happened to these babies was persistent, calculated and cold-blooded.
The press was demanding answers. The parents were looking for justice. As the trial got underway, a series of handwritten notes found at Letby's home were presented to the jury, widely believed to be her confession. But now, in a new twist, it has been revealed that Lucy Letby wrote these notes on the advice of her counsellor.
We now know she was given counselling and indeed a psychologist by the Occupational Health Department at the hospital post-arrest. And it was during that period and upon their advice that she started writing down a stream of consciousness. It was a part of her therapy that this is what she was doing. She's been arrested, she's been kept on bail, she's been arrested, she's been kept on bail, she's been arrested, she's been interviewed for hours and hours, she's been asked in the interviews whether or not she has murdered children.
To me, these are external expressions of the mental anguish that she will have been suffering. The notes also say things like, "I didn't do anything wrong."
My life is ruined, my life will never be the same.
You see, this is what we didn't get from the newspaper articles that went out there, the emotive nature of these notes. She must be guilty. It's a confession. It's not a confession.
The trial moved on to examine the murders themselves, and the jury heard about each individual baby's case, one after the other.
They said she deliberately poisoned some babies with insulin. Others, they allege that she injected air directly into their bloodstream. Others, they say, she used too much milk.
One of the methods Letby was alleged to have used to attack babies was injecting air into their stomachs via the feeding tube.
My name is Dr. Svelena Dimitrova. I'm a consultant neonatologist, and I'm very happy to put my name and title to everything I have to say. However, I have requested for my face to be blurred because I don't want to be recognized on the street by strangers, and I'm worried about potential repercussions due to the sensitivity surrounding this case. I've worked in more than 15 hospitals in my career, and I've worked on 5 surgical neonatal units. Even if we had a theory that a baby collapsed because somebody injected lots and lots and lots and lots of air into their tummy, which would be actually quite technically difficult to do, a competent team would have gone and aspirated it out within the first couple of minutes of the resuscitation of the baby.
When I talk to neonatologists, they say that's just ridiculous. And the reasons it's ridiculous, the tubes are tiny, and to inject enough to cause some sort of catastrophic result, I think A, would take far too long, and B, almost certainly be absurd. But also, when you use a bag and mask over a baby's face, when you're resuscitating them, invariably air will go into the stomach.
Lucy Letby was also accused of injecting air into the baby's bloodstreams, causing an air embolism, an air bubble in a vein or artery, which would lead to collapse or death. During the investigation, the prosecution's lead medical expert saw in the baby's case notes that an unusual skin discoloration had been observed. He discovered in research that air embolisms can cause skin mottling. This expert, a retired consultant pediatrician, had specialized in treating children rather than premature babies.
I would argue that the people who should be qualified to be medical expert witnesses should be people currently practicing within that particular speciality or recently retired. Babies that are born prematurely function in a very different manner to older babies, children, and grown-ups. Our speciality is so different, and it is really hugely inappropriate for non-neonatologists to be giving evidence.
The pediatrician expert, whose findings were backed by a second expert witness, pointed to a research paper written in 1989 by one of Canada's top neonatologists.
They relied on a research paper that was very old by a chap called Dr. Shu, who'd written this and showed that certain skin changes can happen when there's air embolism. Well, he was called to the appeal, and at the appeal he said the skin changes that happened weren't the precise ones that I described.
Dr. Shu Li came forward after the original trial to tell the court that his theory had been inaccurately applied to the Letby case.
One of the people I interviewed was Shu Li, and he was very clear in his mind. The research that he had done, which the police expert witness was relying on, was not appropriate. It was misapplied. It wasn't right.
I've had meetings and discussions with a number of neonatologists, pathologists, and anaesthetists, and not one of them shares the same diagnosis as the lead expert on air embolism.
One of the most compelling planks of the prosecution's argument was that Lucy Letby poisoned 2 babies with insulin. It's alleged that she added synthetic insulin to the baby's intravenous feed bags, causing them to suffer dangerously low blood sugar levels, a condition called hyperglycemia, which can be fatal. Several experts have since challenged the accuracy of the insulin test presented at court.
My name is Alan Wayne Jones. I'm now retired, but I used to be a professor in forensic toxicology. One of the poisons I'm interested in is insulin. I read that 2 of the babies had allegedly been given insulin. And that twigged my interest because I'd written articles about insulin poisoning. So I was pretty knowledgeable about its use as a weapon, if you like. I took a closer look at the evidence in that case, and I didn't like what I found. I read that the analysis of insulin was done by an immunoassay method, and I don't think that is sufficient for use in a criminal prosecution. You need more robust methods of analysis to charge someone with administering insulin with malicious intent. People shouldn't accept that kind of flimsy analytical result.
This type of test should never be used in criminal proceedings. It actually says that on the website of the lab that produced the test. What people say is if you get this test back, you should do a second type of test, which is a more specific type of test. That was never done.
The proposed causes and mechanisms of her murdering these babies were just implausible. And that's a very polite way of putting it.
Nearly all but one was premature. One was less than 2 pounds, I think, and described by one of the nurses as one of the tiniest babies I've ever seen. Now, that doesn't mean Lucy Letby didn't harm them. It does mean is they were probably at high risk of death.
No one saw Letby harming any of the babies. The case is almost entirely circumstantial.
With Lucy Letby, they're alleging she used a whole load of bizarre methods, but the most damning thing to me is if you were going to use all these methods, you would have researched them. But she didn't research any of these methods. How would you expect a neonatal nurse to come up with this without leaving any evidence of researching it on the internet?
I have no idea whether Lucy Letby was innocent. But if there is evidence of guilt, then it's not been presented to the courts as far as I'm concerned.
Another question now being asked is, did these alleged methods of murder align with the original causes of death?
6 of the 7 babies that Lucy Letby is convicted of murdering had had post-mortems at the Regional Specialist Centre at Alderhay Hospital by experienced perinatal or paediatric pathologists. And in all of those cases, or 5 of those cases, they found natural causes, and in one case they couldn't determine a cause of death, but they did not say it was unnatural. None of them had picked up any foul play. I don't understand how the pathologists at the time could have reached these conclusions, and then they were turned on their head and changed completely during the trial.
The question that must mystify a neutral observer here is that post-mortems and consideration by the coroner, which found nothing suspicious, nothing out of order, natural death, can later be overturned on a purely speculative impulse coming from outside by somebody who had never examined the babies himself.
With such specific methods of murder presented as evidence in court, the question remains why the original post-mortems didn't pick any of them up. The jury found it hard to reach a unanimous verdict in all the individual cases. So in some, the judge told them he'd accept a majority decision. In August 2023, the verdict was finally given.
This was a cruel, calculated and cynical campaign of child murder.
Lucy Letby was in court to hear the first 2 deliveries of those guilty verdicts. She did cry. Her parents cried. They were heard whispering to each other, "You can't be serious, this can't be right," and then breaking down in tears.
Lucy Letby was given 14 whole life sentences and a final 15th in July 2024, making her only the 4th woman in the UK condemned to die in prison. But how fair was her trial? And why did no medical experts take the stand for the defence?
There are not doctors who are willing to stand up and defend cases challenging the mainstream view because they're frightened of being hounded out of their careers for it.
Since Lucy Letby's conviction, questions have continued to be asked about the fairness of her trial.
All I can say is on the basis of the experts who've contacted me and the knowledge of the trial I've been able to have, there are lots of things that don't sit well with me and don't make it look like her guilt was proved beyond reasonable doubt.
During the 10-month trial, 6 medical experts were called for the prosecution, but none were called for the defence.
Well, what you have when you don't have defence experts is prosecution experts going pretty much unchallenged. So you're left there with this expert's evidence hanging, with no other experts saying, well, actually, that can't be right. It leaves almost certainly to the inevitable consequence that someone's going to be convicted. Does it surprise me that in the Lucy Letby trial, no medical experts were called for the defence? No, it doesn't. But I know, having been involved in numerous child abuse cases, how difficult it is to get an expert in this country to help you.
A reluctance among some medical experts to come forward may be traced back to the brutal example made of one particular specialist doctor.
I'm Dr. Wayne Squire, and I'm a retired paediatric neuropathologist, which means that for my 40-year career, I examined the brains of babies who have died. My career story has become a cautionary tale, warning doctors that if they stand up and act as defence experts, it could destroy your career.
Preeminent in her field, Dr. Squire was often called to give evidence in court on cases of shaken baby syndrome.
Linda, that's not her real name, but her baby collapsed suddenly one night, and within moments, certainly within hours of him being admitted to hospital, he was found to have some bleeding around his brain and behind his eyes, and the doctors had made a diagnosis of shaken baby syndrome.
The mother was convicted and sent to prison. At her appeal, Dr. Squire gave evidence for the defence.
I started looking at the literature and realised, because of some research I'd read that was current at the time, that this was probably not correct. And there's never been any scientific evidence that actually shows that it's a real condition.
Her evidence helped to get Linda's conviction overturned, but the cost to Dr. Squire was immense.
Once I had given evidence in the appeal, things changed dramatically around me. It didn't go down well. It didn't go down well in the courts. I was forced to go through a hearing. It was a pretty traumatizing time. It totally interfered with my work life, and of course it had a huge effect on my personal life and well-being as well. It was just a relentless 6 months of being told how awful I was, how wrong I was, and yet knowing inside that I'd only been true to the science. When I was being criticised in the courts, and many of my colleagues said, why do you do this? And the answer is that I believe in science. I believed in the evidence that I had read, and I strongly believed that my opinion was backed by good science. And what we were seeing in courts is people being found guilty, people going to prison, people having their babies taken away on the evidence of a hypothesis. I have read about the Lucy Letby case. One of the things that has concerned me is that there are no medical experts for the defence. I think that the fact that there were no defence experts simply reflects what's been going on in this country. And it's worse in this country, I think, than in many cases, in many places around the world, that there are not doctors who are willing to stand up and defend cases where there are babies, where they may be challenging a lot of other people or a mainstream view, because they're frightened of being hounded out of court or hounded out of their careers for it.
In May 2024, Lucy Letby was denied permission to appeal against her conviction.
Understandably, people feel that our criminal justice system works. And if something has gone wrong, then the Court of Appeal will step in and overturn those convictions. Sadly, it does not work that way. Remember that the Birmingham Six were rejected by the Court of Appeal 2, maybe 3 times before that conviction was overturned. The Court of Appeal don't always get it right. In fact, they often get it wrong.
The questions around Lucy Letby's convictions are growing, and doubts about the evidence used to convict her continue to make headlines in the British press.
Has this case been proven beyond reasonable doubt? I think the answer has to be no.
They've been looking from the wrong end of the telescope. They've been looking for an individual explanation, when what's gone on here is quite clearly a whole system failure.
If it's a system failure, another baby is going to die, and I don't want that on my conscience. And I also don't want it on my conscience that an innocent person is locked up in jail for the rest of their life.
If I am right, and these convictions are unsafe, then we have a 34-year-old woman in prison for a crime she did not commit. I will be submitting to the Criminal Cases Review Commission, and it is up to them to decide whether or not these convictions are unsafe.